Welcome. So this is the final video of the coursework series looking at section D, part 2, with an emphasis on P8, M6 and D3, all part of the Health and Social Care Level 3 Unit 5 coursework. So let's take a look at the section D criteria once again. So I'm just going to remove what we've already covered. Here we go. And that leaves us with P8, M6, D3. So we're going to start off with P8 by explaining arrangements of information sharing between professionals. Merit elements asks you to think about the impact of legislation and codes of practice on how information is shared, and the distinction is thinking about the justification of organisations and professionals, how they work together, how they meet the needs of patients, how they manage and share information securely. So essentially, what we're being asked to do is to, for a pass, you need to outline the processes that should be in place when managing sensitive and personal information about a service user. To get the merit, move towards looking at how legislation and other codes of practice influence the team. And for distinction, you need to think about the evaluation of this. So how useful, how successful are these processes? And think about trying to apply all of this to your case study characters, but also bringing in wider examples from the outside world. And I've got a few of these at the end of the video just to kind of demonstrate to you. So first thing you can think about is maybe a slightly different context, is what information does your school hold about you? So I did this with my class, and this is the list of ideas we came up with. So all our schools, or all your colleges, this is the personal information about you that they will hold. And it starts off with, your name and surnames, a photo of you. And it also goes through stuff like your address, your contact information, a bit of your medical history, which is kind of relevant to what we're looking at. It will hold your previous school information, your grades, your qualifications. There'll also be more specific things like attendance stats, reports and reviews from tutors, coursework, and any subject work that's been submitted, personal information about your parents, such as their address and their occupation. So all of this information is held by your college, and just like in this health context, this is generally the kind of information that healthcare settings will hold on characters. So we can think about our case study characters and the community centre that they're engaging with, or the professionals they engage with, will probably have similar, not the same, but they will have some of this information as well. So with confidentiality, what is it? We need to think about what it means. And confidentiality means keeping information private, not sharing that information without the consent or agreement of other people. And it also means that service users, friends, families, and other people are also covered by confidentiality. So going back to that previous slide, your school will hold information about your parents. That information on your parents should also be held confidential, even though your parents don't go to the college. Confidentiality also refers to information relating to those using health and social care services, so records that are associated with them, and obviously no matter what format they're in. So confidentiality, why is it important? So it's important for maintaining privacy. That's a fundamental human right we all share. It's important for trust and personal relationships, and also maintaining security. So these are the key things why we have to have confidentiality. And obviously with our individuals who are being cared for by professionals, by community centres, by obviously healthcare providers, if confidentiality is broken, they may not trust the health and social care sector. They may not trust their provider, and therefore they may not share information that's important for delivering their care. So that's a key thing why we have to have this. Without the trust, people won't reveal information which is important for helping to maintain and continue their care. So breaking confidentiality. Now, there is some exceptions where you have confidentiality, but you are allowed to break it. And often the law states that confidentiality can be broken in 3 circumstances. So if an individual is at risk of being harmed or killed, if the individual is at risk of causing harm or death to others, if the individual is about to break or has already broken the law. So these are instances where you can breach confidentiality or break confidentiality, ultimately to protect the individual, protect other people, or because they've engaged in illegal activities. And then we got on to working practices. So how to maintain confidentiality. So the working practices is again a big part of this topic. What are the community centres? What are the healthcare professionals? What are they doing to protect the information of the service users? So professionals need to know how information is shared and how to share it. They need to be informed of the relevant laws. Any information needs to be locked away, password protected and kept secure. And information should only be given to people who are entitled to access it. So again, these are the key things about confidentiality and how to manage it and maintain it in a healthcare setting. And actually, to be honest, in any setting. And some of the important laws that you would have talked about, these are mentioned in the textbook, all apart from this one here in the middle, GDPR, because this was sort of introduced in 2018. And I think the textbook is written in 2016. So it talks about data protection Act. GDPR is kind of the improved, updated version of data protection, because data protection in 1998 didn't really cover much in the way of online use of information and technology having access to information. GDPR kind of updates the laws and kind of makes it a little bit more relevant to today. So these are really important studies and really important laws that show how legislation is put in place and how confidentiality should be managed. So again, all your settings and all your organisations involved with your case study characters will have to abide by these laws. So let's think about our case study characters, just sort of very quickly based on what we've already covered. So once you've talked about what confidentiality is, how to manage it, how, when you can breach it, why it's important, the legislation that's in place, think back to your case study characters. What information have they got that should be kept confidential? And that could be about their medical history. It could be about their social circumstances, their living conditions, and obviously their current situation. It might be about any medication they're taking, any support they receive, any contact details they may have. Who would and who should access the information? So again, who's going to access the information? Who's going to store it, keep it, and hold it? Who needs to be looking at this information? How can they ensure the right people are the ones that access the information? So for example, with Nusrat, in her case, with her epilepsy, or she comes to the community centre, they should pass that information on to her teacher. And how would they do that? What's the best way to do that? Will information be shared, which we've already covered, but also how will it be shared with the groups providing care? Because again, Nusrat, you've got GPs, epilepsy nurses, you've got the teacher, you've got an advocate, you've got obviously the support worker. There's a lot of people working in her case. How are they going to share information? And again, we're looking, as all these coursework projects are, as a community centre, which is like a local leisure centre or a gym or community hall. This isn't a kind of a centralised medical practice that we're looking at. What could happen if information is leaked or not kept private, and what are the settings or groups doing to manage it? So again, a lot of this isn't in the case study context. It doesn't talk about confidentiality. You've got to kind of imagine what they could be doing, what they should be doing, what would they do if they were in this situation. So you've got a little bit of freedom to kind of think about how they would manage information. So kind of come back to how information is kept confidential. Anything stored on paper needs to be kept away when not in use. That means locked in cabinets, drawers, in maybe a records room that's only accessible for particular people who have permission. Also, you need to think about how long records should be stored. The new GDPR laws say that records should be kept for about 3 years and no more. Many providers now use electronic records, so it's necessary to have secure passwords, secure networks to avoid unauthorized access. And information should only be shared by professionals and done professionally with this need to know basis in mind. So again, not sharing all the details, only the key facts that need to be passed on. Now, the Caldecott report is a really interesting one here because, again, it provides some of the frameworks and the principles of how to maintain confidentiality and how to share information. So definitely one to mention within your write-up. So the principles are that, you have to justify the purpose. Every transfer of information has to be justifiable, has to have a reason for doing so. Don't use personally identifiable information. So that might be you use a code, or you might use just a letter or a number or some indication of the person you're talking about. you need to use minimal information, and then access to personally identifiable information should be strictly need to know. It should be kept private, secure, to avoid anyone accessing it. Anything to do with information has to be stored in compliance with the laws, and duty to share information is important, but again, it should be supported by policies. Your settings will have confidentiality policies and guidelines on how to maintain confidentiality. So moving back to our case studies once again. Now, I'm going to kind of just give you an overview. I don't want to spend too long talking about them. I think it's come up in comments in the past. My setting, the way we use the case studies, we've spoken to the exam board and we amended the original story. So Nusrat, Patrick, Martin, Marie, we had the original stories that were released a few years ago. And a couple of years ago, we asked if we could change the stories and add to the stories and change elements of their lives to try and make it easier for the coursework to be written. So one of the things my setting did was we spoke to the exam board and they allowed us to change the case study. We kind of made amendments and additions, and we changed some situations for the characters, sent that to the board, they approved it, and that's what we use. So that's why when I've been talking in the past, we might have slightly different stories or different events happening with the case studies I talk about, because that's what my setting's done. I also talk a lot about saying using 2 case study characters as opposed to 3. And again, that's one of the things we asked the exam board, if we could reduce the amount of case study characters to 2 rather than 3, and they agreed on that. So again, that's why the way I approach these might be slightly different to how you're doing it in your setting. But just a very general way to link it. So if we're thinking about Patrick, in the case of Patrick, he knows, or in my setting, he has contracted HIV, as opposed to, I think the original is that he suspects or worried he might have contracted it. So Patrick has HIV in my context. When the martial arts teacher refers him or Patrick onto Simon, the sexual health advisor, again, we would use those Caldecott principles. He would pass on the minimum information. You know, there is a member of my martial arts group who has some questions about his sexual health and would like to speak to someone. Is it possible to refer them on? So again, it's pass on the minimum information. You don't want to be shouting down the corridor, you know, oh, Simon, Patrick in, he's have a chat, you're not going to guess what he's done. You know, it's that kind of being sort of minimal with the information sharing. You're only sharing it with Simon because he needs to know. And then again, you can think about the same things when Simon refers, in my context, Simon refers Patrick onto a nutritionist. And again, because he's worried about his physical health. I think one of the other cases, the GP might refer Patrick to the Citizens Advice Bureau. So again, in each case where they're referring on to another person, it would be minimal information being passed on, only the stuff needed to provide support. Again, thinking about another confidentiality, if we're thinking about breaking confidentiality, when would that be acceptable? When would that be appropriate? So Patrick has HIV. The martial arts teacher keeps that confidential, doesn't tell the rest of the group that Patrick has it because he's protecting his confidentiality, his privacy. Now, there's no need to break confidentiality. Obviously, Patrick could be injured, he could begin to bleed, but the risk of transmission of HIV in that circumstance is very, very minimal. So there's no risk to others as long as obviously they manage that situation properly. So there's no need to break the confidentiality and tell other people in that situation. Another example, you could think about Brenda. If she was revealed during one of her counselling sessions about her historic abuse. If Maria admitted that she couldn't care for her mum, and that she's struggling, you know, it doesn't have to be things that you know have happened in the case. So you can make these suggestions of, if this was to happen, if this occurred, if this incident took place, then the professionals would have to do. So you can kind of always talk hypothetically and propose ideas or suggest things that could happen. You don't have to stick really rigidly to the case study. Sorry, I've had a fill-in, so I'm a bit harder to talk at the moment. Managing information. Again, the key section is obviously to understand how managers and professionals secure and keep information protected and safe. So again, it's a lot of the things we've talked about previously. So keeping it locked away and secure, following legal obligations, only appropriate people accessing the information, but also being aware of sharing key information, particularly about updates to physical or mental conditions. And it talks about here about information should always be gained directly from the service user unless they are unable to provide. So again, if someone says, oh, so-and-so, I saw so-and-so do this, or I saw, Alice drinking in the toilets and then got in a car and drove. Again, that's from someone's point of view, and you might have to breach confidentiality, particularly if someone's been drinking and driving. That's a risk to others and themselves. But in most cases, you need to try and get information from the person. For example, if someone's unconscious, or if the individual has a physical or mental condition that prevents them being able to communicate, you might have to rely on other people, but generally you should try and get that information from a family member, from an advocate, someone who knows the person well. So as we move on to writing this section, a few points to consider. So first thing to do, start off with, is talk about your individuals. Talk about confidentiality, what's going on, but talk about your individuals. So what is their situation? What information do they hold, or who holds what information on them, and what information is confidential? So with Nusrat, we know she has learning difficulties, she has epilepsy. This is important information about her mental and physical health. So who is going to need to hold that? Who's going to have that information? Who's important to know? Then think about identifying problems with your case studies. So what could be presented if when managing information? So could anything be done better in their cases? Is there anything that's maybe being done already? Again, context of the case studies don't go into much detail on confidentiality. You might have to make assumptions or make suggestions, or suggest that this is what should be done, could be done, might be done. Patrick, for example, you could talk about his GP is following the confidentiality guidelines by asking permission to arrange a local visit with the housing officer and the Citizens Advice Bureau. However, what would the GP need to do when dealing with the housing officer? So again, come back to those Caldecott reports. What information would they share? Probably they would share the information that Patrick is at risk or worried about being evicted out of his home. He suspects it's because his landlord may be homophobic. That would be the information that would need to be shared. So again, it's this idea about this potential discrimination in housing. Patrick could then reveal that information to the housing officer on his own and tell his story. So again, getting information from the service user is the best thing to do. Once you've moved on from there, think about the protocols in sharing information. So how would information be shared between service users? If someone telephones or appears in person asking for information about a service user, the service provider must check who they are, and only when they are confident that they have the right to access the information should they share it. I haven't gone into much about it in the PowerPoint, but there is a little bit in the text that talks about EPR, so electronic patient records. And again, this is what GPs tend to use. They have a electronic record, which is accessible by most medical professionals. So again, it covers history, physical examinations. It'll have x-rays and scans and all sorts of data on there, but again, it's password protected, it's encrypted, and again, you have to be given access to use it. So again, you could talk about some of these other protocols, other ways of protecting information. And then last, sort of move into the higher area marks. Again, do some research about this topic. So think about what you need to cover. Think about any recent examples, and I'll talk about some at the end. But electronic patient records increase access to healthcare. They improve the quality of care. They decrease costs. However, there are ethical issues related to EPRs, particularly on health personnel. So when a patient's health data is shared or linked without the patient's knowledge, it kind of then removes that control of the patient. We know in Brenda's case study, she doesn't like lots of people knowing her issues and her story. So she probably wouldn't be a fan of these EPRs. So again, there's lots of ways you can think about linking contemporary issues to this. So the last little bit there, really, I'd say general definition and explanation of what confidentiality is. Explain how information is managed by the professionals, what they're doing to manage it, and think about technology, the legislation, and the impact of outside bodies. That's the kind of the starting point. Move on. What is the benefit? So why is it good to have this legislation these codes of practice, how is that going to help your characters? How is that going to help the information sharing process? Come back to the benefits of all this. Why is it good for your characters and the professionals to share? So it's going to be linking back to multidisciplinary teams, some of those ideas. And then last thing to do, D3, try and think about evaluations. What are the pros and cons of sharing information in this way? Are there any problems that can come up from data sharing? Some examples here, and I will put them into the description box, are good examples of data breaches. So I think the first one here is Ed Sheeran. When he was in hospital having surgery, there were people looking at his records who weren't medical staff, weren't involved in his care. I think even like some of the porters and people who weren't involved in any of the healthcare side of it were accessing his records to look at what was going on. Same happened for I think Sir Alex Ferguson when he was having surgery. We've got admins who were sacked for, again, accessing patient information, sharing data, and also the impact of technology. So some good links that could demonstrate some of the ideas, some of the issues with this method. So overall, hopefully that's been of some help. Just again, main thing to do as always, try and write something down, ask your teacher to take a look at it, get some feedback from them if need, and also see what they have to say. That's the main thing I can suggest. Is if you ever get stuck, you've got the textbook, you can talk to your teachers and ask them for a little bit of guidance if need be. Okay, thanks for watching. Hope this helps and good luck with your coursework. Hope you get great grades.